let me get into some of a little bit more specifics about what does compassion fatigue look like, or what could it look like. I don't know how well you guys can see this image, but this is one that I came across at a shelter that I was working with that I found disturbing and didn't know much about any of this at the time, but it seemed to me that something was wrong. And looking back, I think this was probably a sign of compassion fatigue in some of the staff at the shelter. But so there's chalk outlines here of people, of animals. Here's a dog, here's another person, there's a cat, another person. And the blacked out boxes, because they also, not only did they draw all these chalk outlines, they labeled them with various staff members' names. So that was interesting, a little bit disturbing, and so kind of a sign that there might be something going on in that facility. Here's another one that I came across. Just let you listen for a minute. So I always have to point out that is not an effective way of scanning for a microchip, in case you were wondering. Pretty rough handling, right? Regardless of what was going on in there. And so, like, not a bad person. Don't know what was going on in her day, but obviously the experience of that animal was not at the forefront of her mind as it should have been. Even I like to let the volume play on that one too, because you can see what's going on in that room. I think Kelly's doing a session on low stress handling right now, opposite us, so like complete opposite of anything that you would want to do when you're handling a cat. Again, reflecting back on that, there's probably some element of compassion fatigue or some of these related symptoms or syndromes rather going on in that individual's life in that day. So in this second part of the session, what I want to talk about is recognizing the symptoms of compassion fatigue, explaining the importance of self-care, and develop some familiarity with some of the tools that are available and techniques we can use to mitigate the effects of compassion fatigue. And remember what I said before, that I think it's helpful to think of compassion fatigue as an occupational hazard, as something we're going to encounter, and so we need to learn what we can do that works for ourselves to mitigate its effects. So some of the signs and symptoms, there's a number of categories. If you haven't learned by now, I like to categorize things. But here's a list of behavioral signs and symptoms we might see: absenteeism, denial, blaming others, difficulty concentrating, poor work performance, receiving, I always think this one's interesting, receiving or voicing complaints. So it may be other people are complaining about so-and-so's behavior or actions or whatever, but they may also be the one who is constantly complaining about everything else. Maybe they are suffering from some of this problems, substance abuse. Emotional signs: anxiety, apathy, change in worldview. That's that secondary vicarious trauma that we talked about earlier. Hyposensitivity, poor self-esteem. It can look like a whole lot of different things. And then there's physical signs as well: chronic ailments, mental, physical exhaustion, sudden clumsiness. You'll see on lists of signs. And so a lot of times, I get through this whole list, and people are going like, "Yeah, I have that." So maybe it's compassion fatigue, maybe not. So just take a step back. Usually we're talking about a set of symptoms. It's not one thing or the other. It's a bunch of them. They tend to be chronic. They do often describe it as the effects are chronic, but they may sort of ebb and flow. So maybe you have good days and bad days, but sort of overall you're in this sort of downward trajectory. They tend to be really intense. So we're not just talking about mild impact. really intense signs and symptoms, and they start to impact your daily life and the way that you live your daily life and interact with other people. And so that's when we're starting to worry about, is this really compassion fatigue, or are you just having a bad day? How many people are familiar with the 4 phases? Whoa, I see very few hands go up. I encourage you all to Google the 4 phases, and it's a really short article, but it's really great, and it's geared specifically for people working in animal shelters. It was written by Doug Fakema. You guys might recognize his name. He's a individual who's worked in animal shelters. He was as an ED for over 20 years, and then he spent the second part of his career teaching and training euthanasia by injection to shelters all over the country. And he wrote this really great, concise article a bunch of years back, and talked about the 4 phases that we go through in animal welfare work, and how we kind of progress through our careers, and lays it out very nicely. So I'll give you a kind of quick summary. But again, it's a real short read, and just if you Google it, you'll find it on, I think it's actually on his personal webpage, a really interesting one to look at. So he talks about phase 1, where he calls it the zealots. So this is, you're just first starting out in your career, energized, you're enthusiastic, everything is a real easy fix, we can solve all the problems, everything is great, you're going to make a huge difference, and everything is perfect. And then you're in the career for a little bit of time, and you get into the phase that he calls zombies. So you hit this sort of crash and burn, so you become sour on life, you become apathetic. This is sort of a inward and internal phase of this journey that we're talking about here. So kind of withdrawn from what's going on and start not to care about what's happening and the impact you're having on the field. And then that can progress to phase 3, which he calls the misanthrope. So that sort of inward depression turns outward and can turn into rage. You hate everyone, you lose perspective, all the clients are horrible, there's no good adopters out there, they're all, everybody is a terrible person. So you still are not very productive, you lose your effectiveness, unable to connect with people and actually be a productive person. So we're all sort of on this journey, and the goal is to get to phase 4, which he calls peace, and we finally achieve determination and understanding, and really have an idea of the big picture. Really can see the big picture, in that we are making a difference, we are impacting animals' lives, we are impacting the field, we are actually changing the world and doing good things. And so we can kind of find ourselves in these various phases, and you can kind of go back and forth between, hopefully once you get here, you're stayed there in that area, but we can kind of go back and forth between 1 and 3, and I think some of the things that we're talking about today, particularly compassion fatigue and burnout, will be the ones that get us trapped in 2 and 3. And so I just think that's a really interesting way of looking at it. It relates to a lot of people. It's written by somebody who has worked in shelters and with shelter people, and really kind of gets what we're all dealing with on a daily basis. So we somewhat jokingly, maybe not so much, when I worked at UF, because I had taught this to the folks that we worked with, and we were getting stressed out one day, we would be like, I'm in phase 3. So everybody would back away, give you a little space. They knew it was happening. So it became a fun little thing to kind of self-police ourselves. So anyway, so check that article out if you can, The 4 Phases by Doug Fakema. So how do we get to phase 4? Self-care is really important. Like I mentioned before, generally not really promoted in society. We're seeing that change a little bit, but it's often looked down upon. So we're talking about self-care, we're talking about recognizing and respecting our own needs and caring for ourselves as well as we care for others. And so I think that's a key piece of this for us. We're really good at this piece of it. We're not so good at this piece of it, caring for ourselves. I don't usually spend a whole lot of time on this slide, but as I was kind of reflecting on the talks for today, it's probably one of the more important ones I can put up here, because I can't go through this talk and tell you do this meditation, do this thing, do this activity, and everything is going to be fine, because it's going to be unique to each of us as an individual. What's going to work for us, what's going to make sense for us. And so I think this is an important one, because it gives a little bit of a framework for what are the different areas that you need to hit when you're developing your own self-care plan. And so you want to try to hit as many of these subject areas as you can, but it has to make sense and has to work for you. And so I think that's why, personally, when I go to folks talking about compassion fatigue, they often will talk about one particular technique or tactic, and I may not relate to it, and so I don't get as much out of that as I would in another scenario. So just in case you guys can't read them in the bags, it's social, psychological, occupational, financial, spiritual, physical, and intellectual. And those are the big categories that you want to make sure your self-care plan hits. A couple of things. Physical, we're talking about diet, exercise, and sleep might fit into there. Those are really sort of key elements to that. There may be some others that you add in, but those are some critical ones. Intellectual is one that I think we don't often always think of, but really important to learn new things and take advantage of opportunities to learn new things. So coming to a continuing education conference, learning a new skill, learning a new surgical procedure, those things like that can all be really important. Another interesting thing about the occupational category in particular is that there's some data to suggest that you can seek benefits whether this is actually paid work, is your, truly your occupation, or whether you're just volunteering and doing some kind of work that's meaningful to you. So when you get this slide or when you're reflecting later on, think about all these different buckets and how you can develop a self-care plan that hits a lot of these for you. So some folks may not really care about taking care of themselves, but I know that we all care about taking care of animals and the people associated with those animals. And so I also like to present this in the frame of it's our ethical responsibility to take care of ourselves. And there are some interesting data on this. Hopefully it's not too much of a tangent, but I think it's really interesting, so I'm going to share it with you. The Academy of Traumatology, Green Cross Academy of Traumatology, they organize a lot of responders to natural disasters and other large-scale events like that. And they have standards of self-care guidelines for all their employees, volunteers, whoever. They say right in there, these principles declare that it is unethical not to attend to your self-care as a practitioner because sufficient self-care prevents harming those we serve. So again, you may not care about yourself, but I know you all care about your patients and your clients. And so I wanted to explore this thought of ethical violations a little bit more in depth. And it turns out there are some studies on this, particularly in family therapists, marriage and family therapists. They have a really strict code of ethics that's sort of really clearly delineated, and they regularly sort of look at these things and review these things. And so there was one study that showed that ethical violations were more common, according to their code of ethics that they all swear to uphold, were more common in counselors that had secondary traumatic stress and had burnout or signs of those things. Marriage and family therapists that had compassion fatigue, however they define that in that study. Both of those groups were more likely to have ethical violations in their fields. A little bit closer to home, medical errors. So there are studies that looked at critical care nurses that had compassion fatigue, and they were more likely to have medication errors. So I don't know whether it was wrong dosages or wrong schedules, whatever it was. Not only were they giving wrong medications, they also were less likely to report those errors. So they weren't able to sort of identify those problems, correct those problems, whatever the case may be. And I don't know, there wasn't sort of an explanation or theory as to why that might be, but I think it's a really interesting link that we have these, signs and syndromes that we've been talking about, secondary traumatic stress, burnout, compassion fatigue, whatever it is, they're all actually related to some pretty serious ethical violations. So another way of looking at that, so some of the signs that you might see or you might exhibit yourself, you might have seen some of the lists before, are just sort of general behavioral signs and rudeness. And I came across two studies that I thought were super interesting that looked at the impact of rudeness on medical team performance. So again, making that link between some of these behavioral attributes we have when we're suffering from these problems and how it actually impacts our work. And this study had randomized teams of one physician and two nurses per team, and they went through this diagnostic and procedural stimulation. So this was a human hospital, and it was pediatric care, or it might have even been like neonatal care. And so they set up these little teams, and they were going to do this simulated experiment. And so the groups were exposed to rude comments from an outside expert. And so this was basically they listened to a phone call that somebody on the other end of the phone call, maybe like a voicemail, they were listening to what somebody had to say about their hospital, about people trained. I think this was done in Israel, and they were just kind of talking disparagingly about this hospital in particular and medical people trained in Israel, and just kind of sky ranting on the other end of the phone. And they just listened to it. They didn't know who this person was. They didn't call out anybody in particular. And then they went and they did the simulation. So they had to diagnose the problem in the simulated child, the procedural skill, and information sharing, help seeking. So did they communicate with one another across their team? Did they help one another when they had problems? Part of what they found was that information sharing, so how well did they communicate with one another, was positively correlated with how well they performed the diagnostic, how accurate they were with their diagnosis on the simulated model. Whether they sought help with one another and worked together as a team was positively associated with overall performance in actually conducting the procedure. So all those things are positively related. But the groups that were exposed to the rudeness, from, again, non-personal rudeness, somebody they don't even know, they did significantly less information sharing, significantly less help seeking in those groups. So it actually impacted the outcome on that simulated performance. Similar study, kind of a same sort of setup. This time, they actually did some resiliency training in the teams to see if they could counteract that effect. So they had randomized teams. They did what they call a cognitive bias modification pre-exposure. So it's this little computerized training module that they did. That's to build resilience, to help you kind of figure out what's a real threat. Do I really need to worry about this, or is this just somebody running off on their mouth, or that sort of thing. The other treatment, resiliency training treatment that they evaluated, was a therapeutic narrative, so basically a kind of like a journaling activity. So they were exposed to rude comments from a mother in this case, because again, it was at that pediatric hospital. And so this mother, again, not in person, kind of just nothing really directed at them, just kind of commenting rudely about the hospital, about doctors here, about what was going on there. And then they evaluated the same things: diagnosis, procedural skill, information sharing, and help seeking. And they found rudeness negatively impacted the performance of both conducting the medical and therapeutic tasks, so making the diagnosis and actually doing the treatment that they needed to do, how well they worked together as a team, and how well they cooperated. But the cool thing that they found was that when in the group that did the pre-exposure cognitive bias training, they mitigated the effects of that. So it actually showed some effect. The journaling in this case did not actually do anything. Self-care, if I go back to my little diagram here, self-care builds your emotional resilience and improves your well-being. So again, these things are going to happen. We're trying to do all we can to kind of push it over into that side where we're satisfied and happy with the outcome. So when we talk about self-care, it's important that self-care is authentic. And what I mean by that is that it meets our basic needs. So again, that's basic physical needs: food, sleep, exercise. It's thoughtful, it's sustainable, and it's something that can be done regularly, preferably daily. So self-care is not optional. It's also important that when we do self-care and we design a self-care plan, that we incorporate some self-awareness. And self-awareness is the idea that you're simultaneously attending to your patient, your client needs, and your own experience when you're dealing with those needs. And so I'm really good at setting boundaries. So that's self-care minus awareness, setting boundaries. The problem with doing that is less emotional availability, less rewarding work. It doesn't actually impact how you feel about the work you're doing when you do that work. That's not to say these are not important. So the thing about self-care minus awareness is that it actually creates some space for you to do those other things that allow you to engage in self-care activities with awareness, so you can actually build your resilience and make sure that the work itself becomes more fulfilling and rewarding. So you need a kind of a balance of both of those things. So the way that I look at this is three different areas. So one, I think it's important to have some sense of self-recognition. Where do you lie on the spectrum of all the things that we talked about, and what's going to be important for you to address? How can we manage stress, because that's a key component in all of this, and how do we build resilience to make sure that the work itself becomes more rewarding and we're combating the stress that we're going to experience. So one of the most common tools that I've seen in use and most readily accessible is this ProQual, a professional quality of life scale. Has anybody seen this before? A couple hands, okay. So I'd encourage you to go check it out online. That's the address right there, proqol.org. There's a survey you can take. There's a whole lot of information online. And for a while, this actually was the only survey structured survey tool that was out there that people were actively studying. I'm not sure how much active studying is going on now because, as we mentioned earlier, there's a lot more interest in this topic and people are looking at it from a variety of angles. But there's a fair amount of data on this survey tool. And it's meant to measure both positive and negative effects of extreme stress on your life. And so they break it out into 3 separate categories, recognizing there's a little bit of distinction between them all. So they talk about compassion satisfaction and compassion fatigue, and they actually treat those 2 things as the inverse of one another. Secondary traumatic stress and burnout. So if you go through, you can download the survey. There's 30 statements about your experience being in a helping profession, and it'll give you an individual score for each of those things, and then it'll tell you where you lie, if you're low, average, or high in each of those things, and all the various combinations that arise, and it'll give you some tips on where you need to focus moving forward. And so I think this is a good thing to do, just to kind of gauge where you're at, and potentially a good thing to do with staff and to follow up on periodically to see how, if you institute an intervention in your own life or in the work life of your staff, follow up on those scores later on and see if that actually had an impact. It's not, so they're very careful to be sure people know this is not diagnostic of any psychological condition, but it's merely a measure of those 3 components. So the other piece of self-recognition that I think is important is to look at stress and what stresses us, because it's all going to be different for each of us as an individual. So you want to know what stresses you out, what are your major sources of stress, what are your personal early warning signs. It's going to be different for everybody. And so think about physical things that you do, behavioral things that you do, or maybe things that you stop doing. It could be something you start, something you stop doing when you're starting to get stressed. And the idea is that you want to be able to recognize those things as early as possible so you can take some action to prevent them from sort of escalating. So think about stresses at home, stresses at work, and be able to identify what those things are for you. And so you can figure out a response plan. So then you can kind of get to the third question here: how do you cope in the moment? So once you recognize those early warning signs, then what do you do? And I'll make one suggestion that if you don't know what to do, is just stop and take a breath. And we all know, like, all the physiological effects of just taking a nice deep breath has on us physiologically, lowering our blood pressure, lowering our heart rate. But maybe more importantly, or just as important as that, it gives you space and buys time for you to come up with an appropriate response rather than letting that stress tip you over into something else. The other way that I look at this, stress recognition and self-recognition, is by thinking about the concept of trigger stacking. Does anybody know what trigger stacking is? See, maybe a couple nods. So I learned about this term when studying dog behavior. I see it a lot in kind of dog behavior books and literature. And so this is the idea that we're exposed to various stressors throughout the day, throughout our lives. So day 1, you might have this really huge thing happening, and then something small happens, but we're fine. We're able to deal with that. We're able to cope with those stressors. Day 2, we have this like smallish one. We have this medium stressor, this other medium stressor, but it's fine. We're well below our sort of threshold where we can't handle it anymore. Day 3, we have a big stressor, medium to big stressor, and then this really tiny thing happens, and that little stupid tiny thing is the one that pushes us over the edge, and we kind of lose all our cool. So this one really resonates with me, because anytime you find yourself something like, I don't know, you drop a pen or you lose something, and like for some reason it just irritates you so much, like what is going on? It's because you're trigger stacked. You start to reflect back on all like the sort of things that were building up over the day. It makes a lot of sense to me anyways. So just that recognition of it alone, I think is helpful if you're like, wait, that's ridiculous. This is why I'm feeling that way. But we know that when you're trigger stacked, when you get to that point where you sort of tip over the edge, your ability to cope goes way down, your anxiety goes way up. So you want to try to recognize that, prevent it if you can, but certainly recognize it when it happens so that you don't tip over into that place. So stress management, what are some of the ways that we can do that? So I'm sure you guys have been to lots of compassion fatigue talks. I know you've heard a lot about meditation, so I won't spend a ton of time on it, but I do think it's important to bring it up because there's actually a lot of data on meditation. So benefits of meditation that there is data on: physical benefits, happiness. I'll talk a little bit more about what exactly that means in a minute. Benefits on social life, benefits on productivity. If you're interested in kind of looking at some of the data and the explanation behind how meditation benefits those things, this is an interesting website to check out. It's emmaseppala.com, EMMASEPPALA. mindfulness.com, and she kind of goes through all those different things and how meditation can impact them and what some of the evidence is. So, there's evidence that physical benefits, increased immune function, decreases in pain, increased focus, so you're more productive. A number of things show up on there. So this is the part that I think is really interesting, is that there are actually demonstrable structural changes in the brain of people who meditate. There's a number of studies that look at this. And so there's high resolution MRI that's been done and shown that there's increased volume in the areas of the brain that are associated with emotional regulation and response control, increased cortical thickness, which interestingly offsets the sort of normal age-related cortical thinning that happens as we all age. Brain electrical activity is increased in areas associated with positivity. So that's kind of what you see sort of lighting up over here. I think this might be actually the brain volume measurements too on this graph as well. So actual demonstrable structural changes, which I think is really interesting. So then there's this other thing called mindfulness, which is very similar to meditation, or shares a lot of similarities to it, but slightly different. And so when we talk about mindfulness, it's maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment. It's the whole idea about being in the moment, recognizing what's around you, and not worrying about the past, the future, just experiencing what you're experiencing now. And another good resource, lots of information about mindfulness and about happiness studies, which again I'll get to in a minute, on this Greater Good Science Center website. It's ggsc.berkeley.edu. So if you're interested in that, there's another resource you can go to. And looking at some of this stuff, it seems to me there's four sort of main types of mindfulness exercises that keep kind of coming up over and over again. There's something called a body scan, where you're generally focusing that awareness of individual body parts. And usually you start at the toes and work your way up to the head, or vice versa, or whatever it might be. But sort of focusing in that ability to live in the moment, just feel the feelings that you're feeling in those areas at that time. And so it's just kind of a slow way of walking you through that. There's eating exercises, so doing a similar thing with while you're eating. We actually did this kind of as a demo one year during a talk like this, where we had everybody kind of we gave out raisins to the crowd, and everybody took out a raisin and they felt it. So they thought about what the actual sort of tactile feel was, and then they sniffed it and they thought about that, and they put it in their mouth and kind of appreciated the textures of it. So just prolonged this process, so it was really intensely focused, and you can really experience the moment of or that activity of eating, and kind of wipe everything else out. And all these things sort of help bring about those positive benefits we talked about before, and I'll show you some more of that data in a minute. Walking exercise, so literally like walking across a room or walking across a field, very slowly, very intentionally, and noticing what that actually feels like as your body's moving through those motions. And then a loving kindness meditation, which is something that sort of starts with an internal appreciation of yourself and your friends and family and your loved ones, and you gradually sort of increase your circle of loving kindness to those around you, people you don't know, maybe people that you're upset with and don't like. And so that's a kind of more outward way of focusing that energy. But all these things, there may be others, those are just kind of common ones that I see popping up a lot of times. All these things have this sort of chain of events sort of in common. So they focus a lot on breathing, so you can kind of slow yourself down and really focus on the one thing that you're trying to do, noticing the senses, noticing the physical sensations that go along with those activities. And they get to this end goal of recognizing that thoughts and emotions are fleeting. So I think of this as kind of training your brain, just like you would, physically train to run a marathon or do some athletic activity. This trains your brain to combat all those negative emotions that are going to be coming at you throughout the day. And this way they come and you're able to dismiss them really easily without getting upset, without trigger stacking and tipping over that threshold. Does it work? And there is some data to suggest that it works very well. So this is so this study was done in a bunch of nurses. About 27 nurses were evaluated for what they called burnout syndrome. And they defined burnout syndrome as these three components here. So emotional exhaustion, depersonalization, and personal accomplishment. And they had them undergo an 8-week mindfulness-based stress reduction program. So a really formalized program that they went through. And they measured their scores in each of these categories before and after, or with the experimental group and in the control group before and after they did this 8-week program. So this is the mean difference you see in these bars here. So a bigger bar is what we're looking for. So the experimental group, and these were all significant in all 3 groups. Experimental group is the dark bar, the lighter gray bar is the control group. So there was a bigger difference in scores in all 3 groups after going through this 8-week mindfulness training. I also looked at this sort of subjective response or qualitative findings from the study, and how did they interview the nurses and how did they feel after doing this. And they said for the first couple weeks they felt more relaxed. They felt like they were just a general sense of slowing down, sense of peace, sense of being in the moment, which is kind of what this mindfulness idea is all about. And as the program went on, weeks 5 through 8, they felt increased self-acceptance, increased self-awareness, and were more in tune with doing self-care for themselves and felt like it was something they could do. So we kind of saw that transition into being able to accept those things and to move on in a productive way. One other study that I had here, a similar program, they went through the 8-week mindfulness-based stress reduction training. And I thought this one was cool, just like the meditation ones, that they actually demonstrated functional and structural changes in the brain. They did MRI scans and whatnot to demonstrate that. So not before I started learning about this stuff, not something that I thought, that there was this type of data behind it. I'm not, I don't kind of conceptually sort of understand how that works, but I think it's very cool that you kind of do this sort of behavioral thing in your life, and it can cause physical changes in your body. So what I thought we'd do is a very brief, we won't do this for too long for those of you who hate meditation, but we'll give you a little taste of it so you can see what it likes. And I think most people don't. Every time I talk to people about this, and I'll be honest, I don't meditate frequently. Every once in a while I might do a short meditation like this, but I think the biggest sort of complaint about this that I hear with people is not that they don't like it and they don't feel the benefits of it, is that they can't get it to become a regular practice for them. It's not something they can build into their life. So that's fine. I just wanted to kind of give that experience to you guys to do it. We'll do it for like 3 to 4 minutes or so. Just know that's one tool in the toolbox, and you can, there are lots of apps that you can get that'll help you do these. A lot of them are free too. So a variety of ones. This is one I happen to have a recording of, so we'll listen to this for just a couple minutes here.
You can sit comfortably on a cushion or in a chair. See if you can keep your back erect, but without being strained or overarched. And if you can't sit, you can lie on your back on a yoga mat or folded blanket with your arms at your sides. You can close your eyes if you're comfortable with that. If not, or you're more familiar with meditating with your eyes open, that's fine. With eyes open, you can gaze gently a few feet in front of you, find a spot, rest your gaze, let it go. You can deliberately take 3 or 4 deep breaths. Feel the air as it enters your nostrils, fills your chest and abdomen, and then flows out again. Then let your breath settle into its natural rhythm without forcing it or trying to control it. Just feel the breath as it happens, without trying to change it or improve it. Notice where you feel your breath most vividly, most predominantly. Maybe it's the in and out movement of air at the nostrils. Maybe it's the rising, falling movement of the chest or the abdomen. You can find that place, bring your attention there, and just rest. Rest your attention lightly, the way a butterfly rests on a flower, and see if you can feel just one breath, without concern for what's already gone by, without leaning forward for even the very next breath, just this one. Be aware of the sensations of the breath. If you're at the nostrils, for example, you may feel tingling, vibration, warmth, coolness. If you're at the abdomen or the chest, you may feel movement, pressure, stretching, release. You don't need to name these sensations, but feel them. Just let your attention rest on the feeling of the natural breath, one breath at a time.
Anybody feel more relaxed? All right. So you get a little taste of that. And I think that one's kind of a mindfulness-based meditation because she talks about feeling the breath and being focused on the breath itself. So a little bit of a combination there. So the next thing that we want to talk about is building resilience. So resilience is our ability to overcome adversity. I mentioned that a little bit before. And I'm not going to spend too much time on this slide right here, but another one that is important, you could, there are, sociologists and social workers will go through and spend whole lectures and books and discussions on this topic itself, but they talk about 5 pillars of resilience, and so competence, relationships, emotional intelligence, optimism, and coping skills, and these are sort of the 5 big categories of ways that you can build resilience, so you can kind of investigate those a little bit further as your interest allows. But I want to highlight a couple of things here, again, that we have some good evidence to support. And so these are what are called happiness exercises. And before you think I've lost my mind, I will explain to you what happiness what happiness actually is and how they measure that, because I went through these same questions when as I developed this presentation over a few years, and like, what exactly is happiness? How do they measure that? That doesn't make any sense. So I'll show you that in a second. But these happiness exercises that we're talking about, there are 3 particular ones that they've done a lot of studies on. If you're interested in this authentic happiness, Penn has a website. It's authentichappiness.sas.upenn.edu. Lots of information about that on there. So there's something called a gratitude visit, where you write and deliver a letter of gratitude to someone who has been kind but not thanked. There's something called using signature strengths. So you use one of your top 5 character strengths each day for 1 week, and something called 3 good things, where you write down 3 good things that happened each day for a week. And so before we get too far in that happiness, I like this graphic that I came across. And so there actually is a scientific way of measuring happiness. There's something called the Steen Happiness Index, and it's a survey that people can take. And they choose statements from a variety of different groups that describes the way they feel about different scenarios. And so in the end, you get sort of a ranking of, are you bored, are you interested, or are you fascinated by a certain thing? And they're able to come up with this happiness score. And this Steen Happiness Index is what you see in a lot of these studies that talk about what is happiness, and people are more happy doing X, Y, and they've actually measured it in a scientific way. They talk about as a result of those studies or that scale. They talk about having 3 kinds of happy life: a pleasant life, an engaged life, and a meaningful life. So those are sort of the 3 categories that they look at. But the thing that I like to highlight, just kind of on a superficial level, is that we have control over 50% of happiness when you look at these things. There's 50% they say is genetics. The other 50%, maybe we can't control all these circumstances, but many of them we can. So essentially, we have control over 50% of it. So looking at those exercises that I talked about, there are some really interesting studies that showed if they worked. And so let me just go back to those again, because I just want to highlight what that was. So these are pretty simple exercises. What I want to highlight is that this is, write and deliver a letter. So doing this one time, using signature strengths, so one of your top 5 character strengths, provided you know what those are. There's lots of online and other ways of figuring out what your character strengths are. You do this for 1 week, 3 good things, write down 3 good things that happened each day for 1 week. So it's a very short-term investment, at least in these studies. Obviously, you want to try to do something longer term so that you're building self-awareness and you have something that you can maintain on a longer-term basis. But they did these studies. So the happiness exercise, people that engaged in these, they did find there was increased happiness, decreased depressive symptoms. This is the part that I think was really interesting. They did those really sort of short-term, one-time exercises, and the feelings lasted for 6 months for the 3 good things and the signature strengths one. So that's what I have a picture of those 2 graphs up here. So this is depressive symptoms on the vertical scale here, and all these are the ones that were significant. So the placebo control is the open white bar, and the black bar is the ones that actually underwent the exercise. So 3 good things exercised up here. You can see that their depressive symptoms went down all the way out to the 6-month mark here. And then similarly for the signature strength exercise, I just showed you the happiness scale on this one. So the control is the white bars again. You can see that the happiness scale, the black bars went up, and those feelings lasted all the way out to 6 months. So I think that was kind of a really interesting finding in those studies. And so I have tried the 3 good things one, and pretty easy to do. And the interesting thing to me that was surprising when I did that one was at some point in kind of doing that exercise, you started to look for good things happening. So it wasn't just kind of remembering back at what actually happened today that was good, or this week or whatever it was, but actually started to look for it and try to make good things happen. So you had something to write down at the end of the day, or to put in your list. Again, there are apps that you can do that work on this too. So take a minute, think about one good thing that happened to you this week. The other important piece of this is to really recognize, not only identify that thing, but what was the role that you played in that? And that's an important component of this too. So, all right, so here are some more practical things that came out of that Merck study that I showed you about. There was a summary published in JAMA not too long ago, and there's a website that Merck has created that has some of this data on it as well. There's not a whole lot more details anywhere that I could find outside of the JAMA study, but they did find some correlations in activities. So this is the survey of U.S. veterinarians that was done. They did find correlations between social media time and healthy activities. And so all the activities that you see listed here, except for doing yoga, so meditate, volunteer, travel, religious services, socializing, hobbies, reading, exercise, family time, all were more associated with people that were not distressed. Social media time, greater than 1 hour per day on social media, was significantly associated with people that were in the distressed category. So one of the recommendations that they made in this study was try to limit your social media time to less than 1 hour. There's not, they weren't set up to do cause and effect, but that was something that was significant in the study. Yoga, there was no significant difference between the 2 groups of distressed and non-distressed people. So, but maybe it depends on the type of yoga, yeah. Or maybe why you're doing yoga. If you're already distressed, then you're doing the yoga. I don't know. But all the other things, interesting, I think all the other things were associated with being in the non-distressed category. So there's a variety of things you can choose from to figure out what actually works for you and is sustainable for you. So I did want to just throw in a little bit of at least one slide here about for those of you that are in leadership positions. So what can we take away from this, and what can we learn as we lead our teams and manage our teams and at least set them up for success as best we can. And so one thing that you saw coming up, if you were here in the first session, that came up many times was financial planning. And some of this is from the Merck study too, some of their recommendations that came out of here too, but we've seen that across the board in a number of studies now. And so it's important that as managers and leaders, you create space for your staff to take care of those financial issues. So maybe you're able to provide a financial planning professional for them. Maybe you're just allowing them to have some time to address those things, to meet with their own financial planners, whatever it might be. We want to do something to create space for financial planning to happen, because that's a huge stressor on veterinarians, particularly the younger veterinarians graduating these days with even more debt. Encourage healthy activities. We just went through the whole list of things. There are things you can figure out ways of encouraging that throughout your daily work. Creating physical space for those things to happen is one way. Making sure that staff have time and equipment needed to do some of those things. Protecting that break time. All those sorts of things. Just creating space for them to do those things that are going to work for them. Work hours came up a lot in many of those studies, so we want to be really mindful about excessive work hours, evening hours, and what you're asking of staff and employees in that area. Managerial support, another one that showed up in multiple places, so making sure that you have strong managerial support. You have that in place, and maybe that means yourself, if you're in a managerial position, getting the training that you need to be a strong manager. And creating a safe environment to discuss adverse events. When things are not going well, we want to make sure that people can voice that in a safe way and not fear any sort of repercussions. The other thing I thought about and wanted to just share a couple of thoughts with you on was what about people for looking for jobs? How do you figure out what is going to be an appropriate position for you and what's going to set you up for success? And when I thought about sort of the common complaints and actually some of the stuff that Elizabeth and I were talking about during the break too, I think a lot of the complaints and concerns stem from some of that moral stress issue. And so people being placed in positions where they're unable to make a decision that they want to make or know they can make, know is the right one to make. And so I think maybe one way to approach new jobs and feeling out a new position is to figure out what that impact might be on you. So what exactly is your role in this shelter that you're going to take on? Do they just want somebody to come in and do spay-neuter a couple days a week? Do they actually want you to be part of the management team and make recommendations and be a shelter veterinarian? And one of those is not better than the other, but you have to make sure that your expectations are in alignment, or you're going to be setting yourself up for a frustrating position and not going to be very successful. How do we define all those things? Are there actually SOPs, guidelines, principles, or will you be able to create them so that you can set up that plan so that those things can work and everybody knows what the decision-making process is going to be? And are they clear? Are they shared? Are they updated? Is everybody on board with those things? And so you want to make sure that you're on board with what that looks like or what that will look like when you join that organization. And the other thing is organizational philosophy. There's a wide variety of philosophies out there in our field about how we handle animals, which animals should be placed for adoption, which should not be placed for adoption, how do we make euthanasia decisions. There's a huge spectrum out there, and so I think that's one of the things that is very difficult to change or to influence if you're really at odds with the management or the organization, the board of directors, whatever it might be. So you want to make sure that you're pretty closely aligned on some of those things. So that's my thought, sort of my take on how we can kind of put this to practical use for those that might be looking for a position and trying to find a good fit. And then just a couple of notes on seeking professional help, because self-care is not always going to be enough. And so there's a list of things that you may experience or you may see in colleagues and friends. These might be indications that it's time to seek professional help. And so I think one of the most common ones that people talk about, that you see in these kind of books and lists, is people saying, I just don't know what's wrong. I know something's wrong, but can't really put my finger on it and don't know what to do about it. So that might be time to seek some professional help on these things. And AVMA has, actually, on the next slide, AVMA has a really nice website that they've been building and expanding with a lot of information about wellness resources, state-by-state resources that are available for animal welfare professionals. Of course, the suicide prevention lifeline is there for people that might be thinking about harming themselves. So just kind of I want to give you all a couple concrete things that you could take away from this. If you have not done the ProQual survey, I would encourage you to do it. It's pretty easy to do. And like I said, it'll give you a really sort of customized, I don't want to say plan, but a summary of sort of where your scores lie, and it can help you gauge where you are and then figure out what those next steps are for you. And then try to identify one authentic self-care activity that works for you. So, remember, something that involves a little bit of self-awareness, something that's sustainable, and that helps for you. Like I said, I can't tell you which of those things is going to make sense for you and you're going to be able to incorporate into your life. Hopefully give you a few ideas, or at least give you a jumping off point to figuring out which area you might want to work on. And then anybody who is in leadership positions, see if there's something you can identify, one practice that you can initiate with your staff, or one space you can create for your staff to do some of these activities, whether that's physical space or space and time. So that's actually all I have for you guys. I'm happy to answer any questions or have any more discussion, but thanks for your attention, and I hope you enjoy the day and have a great day tomorrow.